Good evening. I'm Sara Jo Best, the Public Health Director for Lincoln Trail District Health Department. Lincoln Trail District Health Department is a regional public health agency that covers a 6-county jurisdiction, which includes Hardin, LaRue, Marion, Meade, Nelson, and Washington counties. I wanted to give you an update tonight from your health department. Currently, there are 35 cases of the coronavirus 2019 or COVID-19 in the Commonwealth of Kentucky across 11 counties. 9 new cases were confirmed today. This information is ever evolving, and this is the most current that I had when I left the office. Kentucky's first death related to COVID-19 has also taken place from Bourbon County. Currently, Nelson County is still the only county within our jurisdiction that has one positive case that is isolated. The main thing that you need to start practicing now is proper social distancing. You do not need the results of a COVID-19 test to tell you what you need to do to protect others. If you have not been standing at least 6 feet or more from other people, you're not practicing good citizenship. There are no exemptions. We expect additional cases each day, just like what happened today, and we need everyone working together to ensure we stop the spread of this disease. We will get through this, but it will take us working together and every resident doing their part. Thank you to the businesses in our area that had voluntarily taken action and have complied with executive orders. Social distancing is the most powerful tool we have to prevent the spread of COVID-19. We know that social distancing makes all of the difference. The death rate from COVID-19 worldwide is at 4.1%. Within the United States, it's currently 1.8. To make sure it stays lower than what's globally, we have to practice good social distancing. We cannot exceed the demand on our local healthcare system, which is what we will do if we all don't do our part. The rate at which the community becomes infected makes all the difference of whether there are needed medical supplies like hospital beds and ventilators to treat the sick. The idea of slowing the virus so that fewer people need to seek treatment at any given time is known as flattening the curve. The curve referred to here is the number of people who might get sick within a short period of time. Without social distancing in place, the curve rises high and fast. That means that our medical system will get overwhelmed quickly. Let me provide 2 real-life examples of what I mean. During the 1918 Spanish flu pandemic, Philadelphia city officials ignored warnings from infectious disease experts that the flu was already spreading in the community. The city instead moved forward and did not warn against social distancing. They even held a massive parade that gathered hundreds of thousands of people together in a matter of days. Thousands of people were ill. Ultimately, 16,000 people from the city died in 6 months. In St. Louis, meanwhile, city officials quickly implemented social isolation and distancing strategies. The government closed schools, limited travel, and encouraged personal hygiene and social distancing. As a result, the city saw just 2,000 deaths, 1/8 of the casualties that occurred in Philadelphia. The city, now known for its towering Gateway Arch, successfully flattened the curve. I would like to address some frequently asked questions that we're getting at the health department. What is a close contact? We use to define a close contact someone who is within 6 feet or less of a confirmed case for 30 minutes or more. What do I do if I'm a contact of a confirmed case? Current guidance is that if you believe that you have been exposed, we ask you to self-quarantine for 14 days. If you become symptomatic but do not have chronic medical conditions, are not a healthcare worker or first responder, not over the age of 60, and are not experiencing difficulty in breathing, we ask you to self-isolate if you become symptomatic. Isolation and quarantine are 2 totally different things, and we hear that spread around, and we want to make sure that you understand what that means. When we ask you to self-quarantine, that means you think that you might have been exposed, but you're not sick. So you're not exhibiting signs and symptoms, but you may have been exposed. And so we ask you to stay home for 14 days. It's not lockdown. You can go outside. We just ask that you limit your movement within the community. If you become symptomatic, that changes from quarantine to self-isolation. Self-isolation is a little bit more restrictive because now you're symptomatic, and we want to make sure that you're practicing good measures to keep others in your household well. So self-isolation includes maybe staying in a room by yourself and not trying to interact in common areas of the household. If you can, using a separate bathroom. And we also want you to isolate away from your pets. What does it mean? I'm sorry, I want to make sure that I do this different. What do I do if I'm off of work because I'm forced to quarantine and I lose my job due to COVID-19? We encourage Kentuckians to contact the Kentucky Office of Unemployment Insurance at www.kewes.ky.gov. How should businesses handle employees with a potentially ill loved one? Employees who are not exhibiting symptoms but have a family member with potential symptoms should practice good hygiene but should be able to work as normal. The loved one should contact their primary care provider for guidance. We get so many questions of a contact. Please know that the health department does not contact contacts of a contact. We look at that case. We wait for us to have a laboratory-confirmed case. We interview that laboratory-confirmed case, and then we establish our contact list based on those parameters I explained before, within 6 feet for a prolonged period of time. So we will contact you. If we know that you're a close contact to a confirmed case, your local health department will contact you. Who should I call if I have questions about symptoms that I might be having? There are 2 numbers that are available for the public to call with questions. One is the Kentucky State Hotline at 1-800-722-5725. For those who live in areas serviced by Hardin Memorial Health and have questions about respiratory symptoms, they may call 270-979-7777 Monday through Friday from 8 a.m. to 4:30 p.m. Hotline use should be limited for those with symptoms or loved ones experiencing symptoms such as fever, cough, or shortness of breath. There are so many rumors going around and so much misinformation. We want to make sure that you have reliable information. As the situation continues to evolve, the public must be very selective in where they obtain the reliable information. We recommend the Centers for Disease Control website at cdc.gov/coronavirus/2019 or the Cabinet for Health and Family Services at kycovid19.ky.gov or Lincoln Trail District Health Department, ltdhd.org. Again, the public can use the hotline staffed for all Kentuckians 24/7 at 1-800-722-5725. We also know that there are a lot of people that are trying to take advantage of Kentuckians through price gouging. There is a number to report that, 1-800-432-9257. When to seek care. And this is so important that we do our part with this because, again, we want to protect our healthcare system for those who are truly going to need it. So prior to seeking care, residents are encouraged to use the following guidelines in making best decisions regarding their health. If you're worried but well, don't go to the hospital, ER, doctor's office. If you're worried and well, going to a hospital or doctor's office just further overwhelms medical staff and adds a higher concentration of people. If you're well, taking a test is a waste of precious resources. We will not get the results we need without symptoms. If you're feeling ill, but if it weren't for COVID-19, you would not have sought medical care, we ask that you don't now. Having a positive COVID-19 test result is not going to change your course of treatment. If you're well enough to stay at home, we ask that you stay at home if you are sick. But over-the-counter things like fever reducers, cold or cough medicines, hydration, good hygiene, and rest. If you are sick but you feel like you have an emergency, call your doctor or medical provider. They stand ready to help you. If you're able to, please call ahead so that they're prepared to receive you. I'd like to end with, again, telling you how important social distancing is. We are hearing each and every day, that doesn't apply to me. It's not in my county yet. I've been working in public health for 18 years, and one thing that I know is that diseases don't care about county lines. It is a matter of time before we see more cases, and eventually we expect to see them in all of our counties. So taking these measures before there's an issue is prevention at its best. We can stop it if we stay ahead of it. Is that all right?